question was, how long do you generally recommend an abdominal ultrasound scan should take? So the obvious answer is as long as you need. But, you know, in general practice in particular, we don't always have the time that we need. So knowing how long something takes can be quite useful, because then you can block off that time in your day so that you can do a proper scan. And it helps if you know, receptionists and nurses who might be booking things in for you have an idea of how long this should take, because then they can allocate appropriate time. Often scans are something that's meant to be squeezed in between a few appointments or between a couple of ops, and actually you wouldn't squeeze a bitch spay in between a couple of consults, and it's similar. The amount of information you can get from an abdominal ultrasound scan is huge, so you should be allocating a good amount of time for it. I think initially, when you're looking at a basic exam of the large organs, when you're just starting and you want to be sure that you've seen each organ in 2 planes and you're trying to learn the systematic way of doing it, it will take about an hour, and possibly even longer if you're looking at small structures. And there's no shame in that taking that long, because if you're doing it thoroughly and you're really thinking about each organ, it will take that time. And if you spend that time doing it, I can guarantee you will get quicker and quicker, because you're spending that time. It's like an investment, basically. Later on, it will take you, it'll be really quick to do a whole abdomen. You can probably once you're experienced, do it in about 20 minutes if there's no pathology and measurements needed to be assessed. But you'll have all the information within that 20 minutes that you need. So really investing that time to spend time and blocking off time to do a proper ultrasound will save you time in the long run.